with that volume of increased patients. Every cardiac implantable device has their own algorithm. They just have more technology than we can kind of keep up with the learning.
Cardiac device techs has been a real problem historically because it takes a lot of training. It's a very intense training. There's only a few places you can get trained.
Is there some administrative help that can also offload a lot of those responsibilities that have your teams not working at top of licensure?
When it comes to cardiovascular care on the organizational level, MedAxiom understands the challenges your program is facing. Welcome to MedAxiom HeartTalk, the podcast where thought leaders come together for one ultimate goal: to continually transform cardiovascular care for all. MedAxiom HeartTalk starts now.
I'm Melanie Lawson, a journalist in Jacksonville, Florida, and host of MedAxiom HeartTalk. I am excited to introduce today's topic. Device techs are hot commodities. So what does this mean for you and your practice or group? Our guests today are Kelli Shifflett and Sirena Bridges. Kelli is AVP of Growth and Business Development, American Group in Austin. And Sirena is Clinical Director of Device Clinic at Centennial Heart in Nashville. Also joining us is Nicole Knight, MedAxiom's SVP of Revenue Cycle Solutions and Care Transformation. So welcome to the podcast, Kelli, Sirena, and Nicole.
Thank you.
Thank you for having me.
Well, it's great to have you all today. And, we have lots to say. You all have very impressive bios. You are experts in your field of choice. So we do encourage you to read their full bios in the episode notes if you would like to know more about them. So the first question is a hard one. We ask all Heart Talk guests. It's really not hard, but it does conjure up feelings, sometimes emotions as to why you got into healthcare. And, if you ever had that aha moment during your career. So Nicole, let's start with you. Did you have an aha moment or what really motivated you to get into this business?
It's very interesting. When I was 5 years old, for Christmas, I got a doctor's kit and always wanted to be a nurse. So I started my career down the nursing path and just really had a passion for taking care of people. And that's what I've always enjoyed doing, is being in front of the patient. So it's interesting how my career's evolved, but still a big part of healthcare.
I think at 5 years old, I wanted to be a unicorn. So you definitely had a reachable goal at that point. Sirena, what about you? Same question.
I am similarly like Nicole. I was at a young age, I had a asthma actually. And so I had very direct interactions with healthcare from a young age. And I actually had a very great respiratory therapist when I was young that still don't know the name, but just remember the care that he gave me and how I felt. And that started my drive to stay in healthcare. So I actually became a respiratory therapist first and did that for several years before becoming a nurse practitioner. And so it's from my own great experience within the healthcare world that I kind of wanted to give back. And the great care I got, I remember years ago, that you don't always remember the names, but you remember how people took care of you. And that kind of led me here.
Yeah, how they make you feel. Wish you could get in touch with that individual and let them know what an impact they have on you. All right, Kelli, what about you? Why did you get into the business?
Great question, Melanie. I actually ask this question when we do new caregiver orientation. I ask new employees why they chose to get into healthcare, and I share my story as well. So I'm happy to do it here. I was a little later in life. I had a very premature newborn baby. And we had to drive 2 hours away to a level 3 NICU to care for her. And we had to leave her there for about 4 months. And I had a 2.5-year-old, so that was a unique experience. But through that whole time, I had great examples of, processes that worked and good communicators. And I had some not so great examples. And so it gave me a certain passion for how can we make it better for our patients when they're in a tough situation, or even just a regular health checkup. How do we make it better for them? And so being a patient like that and being in the healthcare system for 4 months was just a real eye-opening experience. And it gave me a certain passion towards how do I make it better? So the end of that story is that premature baby is now a 23-year-old daughter who is also going into the healthcare field. Who
Oh, wow.
graduate school in occupational therapy in January. So good ending to that story.
Wow, Kelli, that's awesome. And I'm sure you had an impact on her, watching you navigate it and knowing that the direct face and that contact makes a difference to the patients as well.
Definitely.
All right, well, Kelli, let's keep it going and delve into our conversation today. When we talk about device technicians in today's cardiovascular healthcare landscape, perhaps the first thing we think about right now is the staffing gap. It's a major problem in every industry right now. So can you really share your thoughts of why we're seeing such an increase in demand for cardiac device techs and why this need is being unmet right now?
Sure. I'm happy to start that off. Well, first of all, heart disease continues to be the #1 killer in the United States. So we need more cardiologists. It always amazes me. We add more cardiologists and we always need more cardiologists. We add them and they get busy real quick. Cardiac device techs has been a real problem historically because it takes a lot of training. It's a very intense training. There's only a few places you can get trained. I can tell you in my division, we would hire really great techs. They would come work with us for 3 or 4 years. And then a lot of times they would get recruited away. And so we had a hard time maintaining. So the good news on that is that what the pandemic did bring is the ability to figure out, hey, we can work from home. And then we've been able to tap into some retired cardiac nurses and other techs that can work across the United States and still do remote device checks. So it's still a challenge, and staffing has been a challenge in every category in healthcare, and not only healthcare elsewhere, but we're seeing some improvement, but being able to offer that option of remote work has really helped us kind of turn the tables a little bit on that. We still need great techs in the clinic. And the other side of that is just continuing to work for a great company and create a great environment where people are happy to show up every day and do their work.
Sirena, let me bring you in as well. As a nurse practitioner and also the director of the device clinic at Centennial, can you describe some of the challenges that you are currently encountering when implementing cardiac devices into your team's workflow?
Yes. For one, just like Kelli mentioned, it's the staffing. We just, as healthcare has gotten so much better with technology and improvements, we just have the volume of patients just haven't increased. And so with that volume of increased patients, every cardiac implantable device has their own algorithm. They're very sophisticated. They just have more technology than we can kind of keep up with the learning. And so the volume in itself can be a big challenge, just with you normally have a bare minimum staffing to try to provide the exceptional care that every patient desires and they deserve with the staffing, but just with keeping up with all the devices, their algorithm, their technology, the educational piece of that, I think it's really our biggest challenge. We, at our clinic, we try to have lunch and learns. We used to do them quarterly. Now we try to do them monthly, and we just can't keep up with the technology so that when patients come in, we're like, oh, this is a new device. We don't know how to program this effectively. And every device, even if it's a pacemaker or a defibrillator, it does the basic, but every patient needs it to be tailored to their specific indication and their individual needs. And so that's kind of where the device technicians are really, where their skill set is so important and why it's needed. But our biggest challenge, I would say, is just the staffing and just keeping up with the technology.
Wow. Nicole, let me bring you into the conversation as well. Listening to both Kelli and Sirena, it sounds like there's not only a staffing gap, but there's also this education gap as well for people being tasked with implementing these new workflows, new technologies. It kind of sounds like it's a moving target too, because as technology is rapidly changing, that's a good thing. But then again, you have to learn it and become a master of it. From your consulting work in the field, do the clinical and billing and staff typically receive the adequate training they need for in-office implantable devices?
I would say the answer to that is just what Kelli and Sirena said. The challenge of that really with the subspecialization in cardiovascular with our electrophysiology services, our EP physicians are geniuses and know this like there's no tomorrow, but it's hard for them to have the time to be able to educate our teams. So what we've seen is that there's just a gap in resources available to them on how are they going to keep up with the technology, as Sirena said, and how are they going to have time within their workday and their work to life balance to be able to learn that information and really look at the disparity of our systems and technologies and how all that information is coming in. So it's not only learning the technology, it's learning the process that they're working within as well that they may not be used to because it's so different in the device world.
Yeah. So as Sirena, you were talking about going to monthly lunch and learns. Sounds like there needs to be more opportunity to do that training. Do you all see any other opportunities where this could be integrated in just regularly?
We try, like I said, the biggest thing we try to do is to incorporate those lunch and learns. We have actually also gone to a process at our location to try to have each device technician or specialist kind of be a specialist or expert in one particular device per se, so that it's hard for us to all kind of at one time get all the knowledge. And so if one person is great with this one versus that one, it kind of can be that expert in that area kind of helps teaches the team as well, but helps the patients when they come in. Years ago, I mean, patients had options to come in person for their devices versus being remotely followed. And over the years, our Heart Rhythm Society has embraced, remote monitoring to be the standard of care. And so we have almost 95% of our patients are on remote monitoring. And that's it actually it has been clinically proven that it helps addresses patient clinical issues sooner. So it's actually a great standard of care, but it's just how we've kind of had to change how we work in that manner for that. But I say for us, the biggest, we have a great partnership with our industry partners in pacemakers or defibrillators, and they are very well, they stay on top of making sure we get the education we need. It's just kind of like Nicole said, having the time in a busy clinic day or a busy remote day to take, an hour, 30 minutes for the learning. And that's kind of where we've kind of struggled to find what's the best time. Lunch and learns, is it after work? Is it, Zooms? And we've just been trying to find out the best flow that works for everyone.
Sirena brought up a lot of great points. When you're looking for opportunities to train your techs, we're looking for remote device companies that partner with us and provide also some of that training. And so we've even talked to some of these partners about having maybe quarterly, either virtual or actually having some of our techs fly to their site to do some more intensive training. And so, a lot of healthcare doesn't have a ton of resources for this, and there's no reason why you can't partner with some of the companies you work with to help with this training. And that's something that we're pursuing at HCA. So I just want to mention that as an additional option.
Mm-hmm. We're doing a little problem solving here. Well, we will do more in just a few minutes. So this does sound like an excellent place to pause for a quick message for our Heart Talk listeners.
You hear the term care transformation a lot, but what does it mean exactly? Care transformation is redefining the way consumers buy and use healthcare by developing new products, treatments, and business models that integrate separate healthcare organizations or activities. MedAxiom understands that moving the needle in CV care is not simple. It takes vision and leadership, and it requires bridging technology, innovation, and care delivery. MedAxiom experts are helping programs across the country shape the future of cardiovascular care delivery. Through education, organizational performance solutions, and advocacy, we are evolving disease management, innovating virtual care, driving the data revolution, and redefining access and team-based care. Let's transform cardiovascular care together. Get started at medaxiom.com/care transformation.
Welcome back. We have been talking big picture about the challenges to implementing cardiac devices into your workflow and some of the innovative strategies to overcoming them. So now let's just dive a little bit deeper. With the digital transformation and the pandemic, a large portion of the healthcare workforce, as we've already discussed, has shifted to remote work. And to Kelly's point, and sometimes that's really opened up the staffing pool as well. But can the device tech workflow really take place remotely, maybe solely? And if not, what can CV programs do to address this issue? So Sirena, I'll pose that to you first.
At our practice, our device technicians do not work solely remotely. For several reasons, we kind of always pair our device technicians with a device specialist who has a clinical background, be it they are a nurse or APP. And so that pair of a device technician with a clinical person really, we have found, has really helped improve patient care, and it kind of gets patient situations taken care of very efficiently. But I say that we kind of can do a hybrid. There are a lot of roles that the device technician can do remotely. So we might have a day or two there at home where they can, they can call missed patient remotes. If patient has missed a transmission, we need to call them. We work on our disconnected list all the time. Their monitor should always be plugged in so we can get that information. So those technicians can call and kind of troubleshoot those issues. And so right now we kind of do more of a hybrid. I do think going forward, there will be an opportunity where device technicians can probably work more days from home than not. You will always have a device clinic where patients have to come in. There are so many troubleshooting things we have to do, and that cannot be done remotely. So that won't ever go away. But I do think as more stable patients are coming in for just annual visits, or even probably pushed out even further than that, the device technician could do that. One of there's a certification through IBHRE where they just have come up with a remote monitoring device specialist. And I think that's going to pave the way for a lot of device technicians, if they take that exam and pass it, to kind of prove competency in remote monitoring, which will kind of pave the way for them to work from home. I don't think exclusively they could probably be from home without having some type of partnership, or they get paired with a clinician.
Mm-hmm. Yeah, I mean, and it's desirable. I think a lot of employees now at least want that hybrid environment. Right. Where they have a little bit more flexibility. So in the same spirit, Nicole, what alternative processes or resource utilization models might help solve, the challenges that we were discussing today? Is it education? Maybe it's just the gap in not having enough workers. So for example, should programs consider shifting the loop monitor procedure to APPs instead of maybe only physicians?
I will tell you, our loop monitors, now that they can be done in an office setting or in other settings, have been shifted to some of our advanced practitioners. It's also freed up lab time. So before, we were taking those patients to an EP lab and causing some inefficiencies, and that's streamlined that process, and that procedure has really become office-based or being done at the bedside in many of our units. And a lot of that is being done by our advanced practitioners. I'll also say that I think what's happened to support our device clinics as well is ensuring that everyone's working to the top of their licensure. So just as Sirena mentioned, we have APPs, we have RNs, we have technicians in this space. And often what we find, depending on your electronic medical records and how you're getting that information in on your devices and the many different devices you have, we've seen that there's a lot of clerical steps in that process. So is there some administrative help that can also offload a lot of those responsibilities that have your teams not working at top of licensure, to ensure whether they're working at home, working in the clinic, that they're truly doing device work and having the support that they need and not having to do all the other tasks. So I would say that's been a huge improvement we've seen with some device clinics, is adding that administrative clerical support, IT support, to really help streamline those processes.
Mm-hmm. That helps. Kelli, let's bring you in now, because we know that artificial intelligence will continue to help shape the future of healthcare. And if you've been to CV Transform, which I know you at least have, perhaps more accurate, we like to call it collaborative or augmented intelligence. For example, AI helps reduce false positives, and it adds precision and certainty to the work of clinicians. So have you seen AI, in this case, also augment some of the processes and regular operations of cardiac disease management?
Yes, I think we're at the very beginning of it, though. I mean, a lot of people talk about AI right now. It's just algorithms, that make the process a little bit smoother. Of course, you're never going to replace the clinician that's going to review it. But I think that as we get smarter in using this data, and that we get very consistent, and we all agree on the protocols, that AI certainly has a future in remote device management for sure. I think we're just in the early stages of it. I did want to back up, if I could, Melanie, a little bit about remote device techs. I think this is one of the positions that lends itself to having people work from home. And I agree with Sirena that you're always going to have a hybrid because you've got to have in-office checks. But because you're able to, hire folks that do have clinical training, you can quantify their productivity by how many interpretations that they're able to do each day as they review those prior to the physician looking at them. You can quantify their work level. You always have to bring the remote folks in just to make sure that they're connected and engaged with the team, and that there's good communication flow between all the teams. Because we have EMR and we've gone through the pandemic, we're more comfortable with the idea of working from home. So I think this is one of the unique positions that it lends itself to it. And I think AI will be a part of that going forward. We're just in the early stages, and we need to see where this leads us. But I think definitely it's going to be a piece of it that'll kind of help maybe remove some of the administrative burden that we're having to deal with today.
All right. Well, in the spirit of AI, let's all look ahead 10 to 15 years from now. What changes do you predict that we will see in device clinics, and also that device tech role? We've already discussed some of this, especially with that hybrid role. But what else are you believing for in the next 10 to 15 years? Sirena, you want to try this one first?
I do think in 10 to 15 years, most of the role will be remotely by that time. And I think we will see patients come into the in office less. I think with technology has improved, patients will come in for routine checks very less, and we'll see patients who need to be seen. Patients with problems will come in and we can have priority for them. And then patients who are stable, we can probably spread out or push out some of their standard checks that we do pushed out a little farther. So I think the way technology is going, we will probably do more remotely from a remote standpoint of transmissions, and see patients in the office based off symptoms or problems versus always just seeing a standard, straightforward patient who's doing well.
That's a win-win. Then you're, like you said, seeing the patients that you need to see versus everyone. Nicole, what are your thoughts 10 to 15 years from now?
Yeah, I do think, similar to Kelli, that AI is in its infancy. I hope in those 10 to 15 years, we're seeing a lot of advancement in that area. But I do think we'll have a virtual support system for our patients to deliver care across. And I think this is definitely a space we'll see it in. And I think also we'll see education platforms for our teams to help with retention and recruitment that are virtual, to support that and really look at a balance to help them be able to be educated, whether it's from virtual academies, education platforms, but also be supported virtually through what we're doing in healthcare.
That sounds like that needs to happen in the next year or two, not 10 to 15 years based on this conversation. Kelli, what about you 10 to 15 years from now? What changes do you see or progress?
I think it's going to be sooner than 10 or 15 years. I think as we incorporate more of these wearable devices, we all have smartphones, Fitbits, Whoops, whatever we're wearing. And that information is getting relayed. And we're just trying to figure out now, how does the provider interpret that? How do we bill for that? How do we track that? And is it meaningful information? And so, assimilating all that data is going to be kind of the next, how do we bring this all together on one platform? In the beginning, we just had a couple of companies and we could log into their websites. And now we've got, 20, 30, 50 companies and all these different products. How do we assimilate them on the one platform? And then how do we put that data together in a meaningful way that our cardiologists can interpret and take action on? And I think it's kind of exciting that we have these wearables, because now, people can, they don't have to wait to come in and get a Holter monitor. They can, get some indications right now on their smartwatch that maybe something's not quite right, and at least find out if it's real or if it's, just a false, whatever. So I think it's going to be sooner than 10 or 15 years. I think we're already there. It's just figuring out what to do with all this data that's flowing in and how we're going to manage it.
So we've been talking a lot about how much data really is out there. So do you predict that there could be a new role on the care team to help analyze and handle and assimilate all of that incoming data?
I do think that there's definitely never enough dedicated IT resource to making this happen, but I don't know if it's another role or if it's just for technology to catch up.
I think too, it's getting, if we're using a remote device monitoring platform from a particular company, they have to be kind of software agnostic. They have to be willing to accept data from every company, even if they offer a competing device. And then the smart company is going to help us bring that all together and assimilate it in a way that's meaningful for someone to interpret. So I think it's first, getting the platform, and then two, whether it's, I don't know if it's an individual, I agree with you, we always need resources in IT, but just teeing it up in a way that is actually meaningful to our providers is how I see it.
So what role will industry play in this?
With the right vendor partnership and us giving them feedback about what our providers, meeting with our providers regularly and saying this, not that, could you tweak this, could you tweak that, through that partnership that we could probably get there. I don't know, Sirena, maybe you feel differently about it, but I think it's going to have to be a good partner.
I agree, a good partner, but I do think a lot of the new software platforms we have out there now are trying to get better with prioritizing what is actionable versus what's not actionable. There is some difficulty depending on what's coming from each side, each industry side. I think any specific company will be great for their own particular devices, but not for their competitors. So I'm more of an advocate for a very neutral platform that kind of can take all the data to the best it can and kind of prioritize and so I think all of them in general trying to head in the direction to make it better and more streamlined for the clinicians and the team.
That's another discussion for another day, because as to your point, there is so much we now know that we did not have access to. Well, this was fabulous. Kelli, Sirena, and Nicole, great conversation today. We thank you so much for sharing your time and, of course, your expertise and your passion behind the work that you do today on MedAxiom HeartTalk.
Thank you.
Thank you so much.
That's it for this episode. If you liked it, please tell your colleagues and let them know they can subscribe to MedAxiom's HeartTalk on Apple, Google, or wherever they get their podcasts. Now, if you'd like to send us a note directly or suggest a topic, we're always open. Email us at hearttalk@medaxiom.com. Thanks again for listening. This episode is supported by an independent educational grant from Medtronic.